Hello, welcome to this NMC OSCE tutoring video. My name is Hannah and I'm a registered UK nurse, a university lecturer, and have been an NMC OSCE programme lead in the past. And I provide one-to-one private NMC OSCE tutoring if you need a little bit extra support and help with your OSCE preparation, which can be fully flexible and tailored around you. So on this channel, I share all my advice and tips and teaching to help you self-study and succeed in your OSCE exam without having to pay an absolute fortune to go and sit in a classroom and listen to a training centre. So today I'm going to focus on the subject of duty of candour, which you'll know will come up a lot in the professional values scenarios. And if you are looking through the marking criteria for those professional values, you will see duty of candour mentioned in nearly all of those scenarios. And it's very tempting to memorise the marking criteria and not actually really understand what duty of candour is and what it means for you as a nurse once you are on the NMC register. So I'm going to look at duty of candour in more detail so you understand it. So not only to help you apply it to those professional value scenarios, but also when you are registered with your PIN, it's absolutely essential in terms of maintaining your own accountability and your own and maintaining that registration and that PIN, that you understand duty of candour and what it means for you as a nurse working in the UK. Let's get started then. So like I said, you'll notice when you look through the marking criteria for the professional value scenarios that duty of candour is a common requirement and something that you're expected to know and recognise and apply within those professional value scenarios. So what is duty of candour then? So it was something that we haven't always had duty of candour. So when I first started nursing 20 years ago, we didn't have what we officially call duty of candour, but it was formally introduced into the UK. And it came on the back of some very high profile cases within patient care and NHS trusts, where there was significantly poor patient care and lots of failures within healthcare systems. And it became a legal obligation. So this is the first thing you need to be aware of, the duty of candour, that it is a legal obligation and it is within the Health and Social Care Act of 2008. And it came into force in 2014. And this kind of statutory requirements, this legal requirement of duty of candour, applied specifically to healthcare providers and healthcare organisations. And like I said, it came about from, direct failings and these kind of big, high-profile failings in care where, patients unfortunately died, and there was quite a lot of system and organisation failings. And it really highlighted the need for greater transparency, and also greater accountability. And the most significant event leading up to duty of candour coming in was the Mid Staffordshire NHS Foundation Trust incident, or scandal it's called in the newspapers. But there were serious failings in patient care. And if you're not aware of that, it's maybe, it's a very reflective and thing to look and read up on, and kind of you can really see the impact of when we are not open and honest and when there are organisational and system failings in patients' care. And on the back of the Mid Staffordshire incident, we got the Francis report. So this was a public inquiry into the failings in care. And one of the key recommendations from that report was establishing the duty of candour. So why was it introduced? So firstly, to kind of improve that transparency and accountability. So there was a lot of failures in the Mid Staffordshire around transparency and accountability. And, healthcare organisations, there was a culture maybe of secrecy where mistakes and poor care were not normally reported. So it wanted to rectify that. Like I said, it's one of the key recommendations from the Francis report. So the Francis report emphasised that healthcare providers and staff must be open and honest when things go wrong. So we shouldn't be covering up. We should be open to them. We should be reporting them, and we should be kind of learning from them to improve future patient safety and quality of care. It was also introduced to build a culture of openness. So the duty of candour, it's underpinned by this culture of being open and learning within healthcare. So being transparent is a legal requirement, And, it's to encourage us, like I said, to admit, so healthcare professionals individually, but also organisations, to admit when the mistakes have been made and to learn from them. And it was also introduced to try and restore public trust. Like I said, there was a number of what were termed healthcare scandals. I don't like the word scandals, but, failings in care. And it was intended to restore the trust in public trust in the NHS by acknowledging that we need to be truthful with patients about their care and with their families. So there's two components of duty of care which you should be aware of. So one is the statutory requirement. So this is the legal requirement. So like I said, this is why it's so important for you to understand. So it's a legal requirement, and which we are obliged as healthcare organisations and healthcare professionals individually to notify patients or their families when an incident has occurred that has resulted in or could result in significant harm. And organisations must provide an explanation and offer an apology and outline actions that are going to be taken to prevent similar incidences. And then there's our professional duty of candour. So this kind of follows on from the statutory duty, and it applies to Nursing and Midwifery Council and General Medical Council. And it kind of in 2015, they introduced the professional duty of candour. And this applies to us as individuals, so doctors and nurses, allied health professionals as well, emphasising our own personal responsibility to be open and honest with patients when errors occur. So it's not just about the organisation or the trust or your workplace, it's about us as individuals. And, a lot of this focuses around professional behaviour, okay? So we have a duty to be open and honest. We have a duty to encourage a learning culture and report adverse instances that lead to harm or near miss. And when you look at the professional values marking criteria, you'll see a lot of these points are contained within that. So there's always lots of points around, documenting the incident or what we've seen, recognising any learning from this as well, recognising, about this behaviour hasn't been open and honest and therefore is not reflecting duty of candour. So how's it carried out in practice? So, if an error was to occur, then we'd obviously want to identify the incident. And again, we can link that to the professional values marking criteria, because we always need to recognise and acknowledge in that scenario what is the unacceptable report practice that has occurred. We're always going to report the incident, so through trust incident reporting forms or potentially witness statements. We need to inform the patient or the family. So if the patient has been directly involved in harm, we need to inform them. We need to be providing support, okay, and we should be offering a formal apology. We need to be documenting the incident, okay, so not just reporting and verbally escalating it to our line manager or, the line manager system within where you're working, but documenting that incident as well. And most importantly, we need to be learning from the incident. So again, a lot of these points you will see in the professional value scenarios, because there's a similar way that we respond to unprofessional behaviour or behaviour that puts patients at risk or any harm. So like I said, duty of candour is applicable to nearly all professional value scenarios. So when you've got your professional values and you're trying to remember, should duty of candour be one of your points? Think about, is there a risk to patient care, or could patient care be compromised? There could be something, directly. So maybe, the hospital food, senior hospital food, that has compromised patient care because there's now no food for the patient to have. But it's also not showing that honesty and integrity of behaviour. Or has an actual error occurred? So, for example, with your drug error, or has harm occurred to the patient? So, witness abuse, for example. So, thinking about those things should trigger you to think about recognising the need to follow duty of candour. And, has the behaviour not shown honesty and integrity? So, all those professional values which talk about falsifying observations, falsifying timesheets, false representation, that is all that member of staff involved in that is not demonstrating honesty and integrity, and that goes against duty of candour, where we are trying to enable and ensure an open, transparent and honest culture. So I hope that was helpful. A little overview of Duty of Candour, like why it's important. It's not just about memorising Duty of Candour, the words, and putting it down into your professional value scenarios. You know, put it into your own words, understand why and where this professional value scenario has breached Duty of Candour or Duty of Candour has not been followed. It's really important for your ongoing practice beyond your NMC exam when you're working in UK healthcare. So I hope that's helpful. Please like, subscribe, share my videos. Thanks for all the comments. I try to answer them as I go and as honestly as I can with the information that I have available to me. I'm available for one-to-one tutoring, most probably only place in the UK where you can book directly one-to-one sessions, and that can range from 1 hour to 2 hour to a whole kind of course. But I do get really booked up, so most probably at least fully booked up now until the beginning of December. But please check out my social pages, so Facebook and Instagram. I put a lot of other helpful information on there as well. So Nurse Tutor Tutoring with Hannah.